Okay, thank you. Good afternoon. My name is Dr. Jeff Schultz. I'm a psychologist at the Chronic Pain Center. And this afternoon I'm going to be talking to you about sleeping difficulties that often accompany ongoing or chronic pain. Now, hopefully I'm going to give this talk in such a way that it doesn't put you to sleep, but really most of you are probably interested in learning about what you can do for the sleeping difficulties. So just in a little bit more detail, what I'm going to talk about this afternoon is first to just describe what are the most typical kind of sleeping difficulties that we would see at the center or that we would see with ongoing pain. And probably most of you who are watching this are interested in the last point, that is solutions. What can you do about ongoing pain and sleeping difficulties? Now, in order to understand why some of the things that I'm going to suggest make sense, I'm going to have to describe a little bit more about what are the causes of sleeping problems. And in order to understand why those causes are causes, then I'm going to talk a little bit about what happens during sleep. So let's start with just a description of the frequently occurring types of sleeping difficulties. The first point that I wanted to make is that sleeping problems are very frequent with ongoing pain. Now, if you look in the medical literature, you'd often see figures that say around 50 to 70% of people that are experiencing ongoing pain have some kind of sleeping problem. But in my experience, more rare that I don't see somebody with without sleeping difficulties. So the first point anyways is that they're extremely common. Sort of as a disclaimer here, I want to say that there are lots of different types of sleeping problems. I'm going to be talking primarily about primary insomnia or difficulty with sleep. You do want to get, if the sleeping problem persists, you do want to get it checked out with a physician here. Now, one of the things that I frequently find here is just a difficulty with getting to sleep. So people will say they have an increased time to fall asleep after going to bed. Now, you notice here that, without pain, the average that it takes a person to get to sleep is around 20 minutes. Now, and then with pain, that 20 minutes is approximately around 60 minutes or so. Now, just as an aside, any of these numbers that I'm going to talk to you about are really, you would think that they'd be on a bell curve or on a distribution so that on average it's around 20 minutes. But there's always going to be some people, particularly some of the wives will talk about their husbands getting to, as soon as their head hits the pillow, they're asleep. So they might take 5 minutes to get to sleep. And then there's some people that just by nature may take up to 40 minutes to get to sleep. So you want to think of this on average as it's around 20 minutes, but that distribution shifts with ongoing pain, so that on average about 60 minutes. So there are still some people with with pain that are taking a couple of hours to getting to sleep, and so but on average again that there's a change in the length of time that it takes to get to sleep. And it's important for us to understand why that is. Is it due to pain? Is it due to difficulty shutting your mind down, or perhaps both? Because all of those things can happen. Often with ongoing pain comes a number of other stressors in one's life, and therefore it makes it difficult to actually fall asleep, because people just have a tendency to start thinking about problem areas in their life as they're lying down and trying to get to sleep. So increase in sleep onset latency, that we would call that, or difficulty getting to sleep. Then there are some people that you would talk to that say, I can get to sleep okay, but sure enough, every hour and a half, I'm waking up. And so nighttime wake-ups is another very frequent difficulty that we would see with ongoing pain. And we'll discuss a little bit more about why that is, but often that can be due just to pain, but when it's frequently over a period of time, it can be problematic. And then there are some people that will say, well, I can get to sleep okay, waking up maybe once in the night, but sure enough, 4 o'clock rolls around and I'm up and I can't get back to sleep after that. So that would be an early morning wake up. And it's important for us to understand again why that is. It can be, but not necessarily that this can be a sign of depression. It also can be just due to the fact that the sleep cycle changes, which we'll talk a little bit more later. Okay, and then the final aspect of common problems that we would see are what we call poor quality, just not feeling refreshed in the morning. So you go to bed and kind of fight throughout the nighttime, and then morning comes around and you're just feeling really bagged, just not feeling refreshed. And sometimes that can be due to an overall decrease in the number of hours slept. You can see here that on average, again, the average adult human sleeps for around 7 to 8 hours a night. But notice here again that there's incredible variation, or quite a bit of variation around that normal, or what's normal. So there are some people who are lucky, or maybe unlucky, depending on your point of view, that only need 4 hours of sleep a night. And then there are some people that just again, need around 12 hours in order to feel refreshed. But say on average, it's around 7 to 8 minutes. And again, you can see that with ongoing pain, that people will typically sleep for around 4 to 6 hours. So there's a drop in the total number of hours, and that can contribute to that not feeling refreshed. One of the ways that we quantify that is in this metric that we call sleep efficiency. And we would say that anything less than 80% is kind of on the area of a problem. Sleep efficiency I'm going to talk a little bit more about, and that just refers to the amount of time that you're actually sleeping while you're in bed. Okay, so for example, if you went to bed and you were lying in bed for 8 hours and you only slept for 6 of those 8 hours, then your sleep efficiency would only be at 75%, or 6 out of 8, 3/4 is around 70, or is 75%. So that would be. So that thing is something that number is something that we want to pay attention to as well. The amount of time that you're in bed not sleeping.